I really should just put my face on something and be like, take this. That would be wrong.
Episode 5, take 1.
So when it comes to over-the-counter supplements, there's not a lot of clinical evidence that they're helpful for insomnia, but what they may be able to do is help with the underlying cause of what's keeping you awake. Things like anxiety, pain, muscle spasms, stress, depression, or simple things like jet lag or shift work that mess with your normal sleep schedule. Most of these supplements are divided into 2 main groups, the ones that affect serotonin and the ones that affect GABA. Serotonin is a hormone your body naturally makes, so supplements like melatonin, tryptophan, which we've all heard about after you eat a nice turkey dinner, and 5-HTP, they are supposed to help supplement serotonin to help you relax and sleep a little bit better. So the next group of supplements affect a neurotransmitter called GABA. GABA is what we call an inhibitory neurotransmitter, so it helps calm things down when it's stimulated. These supplements that affect GABA include apigenin, which is a flavonoid found in chamomile tea, valerian root, GABA itself, L-theanine, and glycine are other examples of supplements that are supposed to have some sort of calming effect on GABA in the body. There's also been a lot of renewed interest in cannabis as medicine, and the 2 main components we talk about are CBD and THC. CBD is over-the-counter in a lot of different supplements, and at higher doses, usually 50 milligrams or more, it has been shown in studies to help with insomnia. THC, on the other hand, is usually only available by prescription or medical facilities, but it can be available over-the-counter in many places, and THC can be effective for insomnia due to pain or specific health conditions like Alzheimer's disease, Parkinson's disease, that can have difficulty sleeping. So finally, as a clarification, over-the-counter herbs and supplements are not FDA-approved medications, and they aren't regulated. So you should proceed with caution and talk to your healthcare provider or pharmacist when it comes to choosing a reputable brand and the right product and dose for your needs. Oh, sorry, are we done? I'm just like moving on to the next thing.
Yeah, got it.